Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about autoimmune polyglandular syndrome. If you see in the autoimmune polyglandular syndrome, it is of two types, 1 and 2. In autoimmune polyglandular syndrome 1, AIRE gene is affected on chromosome 21q, whereas in autoimmune polyglandular syndrome 2, HLA-DR3 and CTLA4 is affected. So in type 1 you will see presence of autoimmune. There will be autoimmune polyendocrinopathy, then candidiasis will be seen, ectodermal dystrophy is seen, then you will see presence of hypoparathyroidism. Okay, then in this HLA-DR3 or CTLA4, it shows hypothyroidism, hyperthyroidism. It causes premature ovarian failure. It results in vitiligo and type 1 diabetes mellitus, and it causes pernicious anemia. So these are the two different types of autoimmune polyglandular syndrome. Thank you for watching.
Thank you and thank you for watching.